Hi there, my name is Christina Antello, and I am a advisory board member of the Congressional Hispanic Caucus Institute. I used to be the interim CEO and was on the board for about 6 years and have tremendous passion for CHCI and all of the fellows. And I'm proud tonight to be part of this CHCI Alumni Association event. On behalf of the CHCI Alumni Association DC and Chicago chapters, I want to welcome you to this important conversation tonight. For over a year now, the COVID-19 pandemic has disrupted our daily lives in ways most never imagined, unable to see our families and friends, and many losing jobs left and right. However, having to choose between your family and career, inflexible schedules, and lack of access to healthcare have been issues that Latinas faced long before the coronavirus. The pandemic simply exposed them to our spouses and partners and employers to see how much this country depends on the labor of women of color, including Latinas. The state of Latinas in the workforce during the pandemic has been anemic. Just look at the latest jobs report. Women labor participation is at its lowest level since the late 1980s, probably since many of you were born. Since last year, 2.3 million women have left the workforce, including over 600,000 Latinas. And 8.5% more Latinas are unemployed compared to white men. One thing is clear, we're far from out of the woods, and now is not the time to be complacent. Black, Hispanic, Latinx, Native American, and Pacific Islander people are more than twice as likely to die of COVID-19 complications compared to white people. Moreover, white people are reportedly vaccinated at higher rates compared to other racial groups. While there is some hesitancy among some communities, lack of access to healthcare is a greater barrier among Hispanic and Latinos. This is a national emergency, and it's time that we treat it as such. If we don't, we risk the hard-won strides that we've made when it comes to equity in this country. But we have an opportunity right now. We have the chance to rebuild our economy and our health systems in ways that value Latinas the way that we deserve. Equal pay for equal work, fair wages, access to healthcare and vaccines, flexible work schedules, and fair paths to promotions, and advocating for yourself and our community. All of these are crucial to ensure that we're prepared for the next crisis. Now, you'll be hearing more about this important topic from an incredible panel of CHCI Mujeres, who together bring so much expertise about the challenges at hand and what we're going to do next. Without further ado, I'd like to pass it over to your moderator tonight, CHCI DC Chapter Vice President, ALIZA AUCES. Thank you very much.
Thank you, Christina, for your leadership and for those wonderfully said and important remarks. As Christina mentioned, my name is ALIZA AUCES. I currently serve as the Vice President of the DC CHCI Alumni Chapter, along with my colleague, Tony Hernandez, our President. And I'm now going to go ahead and take a moment to introduce 3 other amazing CHCI Latinas that are not only trailblazers in each of their respective industries, but are also influencing the conversation to create equitable change for our comunidades. First, I'll start with Berenice NUNEZ Constant. She serves as the Vice President of Government Affairs and Civic Engagement at ALTIMED Health Services Corporation. In her current role, she leads ALTIMED's legislative and policy agenda to advance state initiatives to eliminate disparities in healthcare access and outcomes for Latino and multi-ethnic underserved communities. Berenice also led the foundation of ALTIMED's Civic Engagement Program, aimed at impacting the social determinants of health faced by many of the patients and communities served by ALTIMED through integrated voter engagement and community mobilization efforts at the state and local levels. Thank you for joining us today, Berenice. Next, I'm going to go ahead and introduce Alejandra Castillo. She is the immediate past CEO of YWCA USA, which serves 2.3 million women and girls around the country with a network of over 200 associations. YWCA plays a dual role as a social service provider and advocate for reform and justice. Under Castillo's leadership, she raised over $270 million for YWCA USA and turned the 162-year-old non-for-profit into a data-driven organization focused on creating measurable social impact through innovative approaches to address 21st century challenges and realize opportunities across 1,300 communities. Castillo has more than 2 decades of professional experience in Washington, D.C., having served in senior leadership in 2 presidential administrations in areas of international trade, minority entrepreneurship, and economic development. And lastly, we have Alejandra Aguirre. co-founder of the Candena Collective, an online marketplace for artisan women to sell and showcase their handmade products. Alejandra began her career in Washington, D.C. in government affairs and politics before starting her own small business. She has an extensive community outreach experience and is most passionate about uplifting Latino voices to positions of power and advocating for economic development for historically marginalized communities. Wow, this is such an amazing room. I am so privileged and honored to be here on this webinar with each of you ladies. As well, before we begin with the first question, we encourage you, the audience, to submit questions in the comment section, and we will try our very best to answer as many as we can towards the end of the event. Thank you again for all joining. So for our first question this evening, I would really love to learn if you could please highlight the issues that have a disparate impact on Latinas, particularly amid the COVID-19 pandemic, and issues you foresee as well in the post-pandemic. Let's first begin with Berenice.
Yeah, absolutely. Thank you. And first, let me just say this is amazing. I'm so excited to be here as part of this illustrious panel. And I am here also representing the graduate fellowship class of 2010. They would kill me if I didn't say that. So thanks for having me again. First, I think as it relates to the disparities in this pandemic, there have been many, unfortunately, that have been revealed, at least on the healthcare front, that I can speak to. It's now abundantly clear and an undeniable fact that Latinx communities have collectively faced the most damaging health effects from COVID-19. The data shows that this pandemic is predominantly a Latino pandemic. Frankly, this outcome is because of the historical, structural, and institutional racism that preceded the pandemic and continues to persist today. On the healthcare front, we have seen and continue to see this inequity manifest itself into higher COVID infection rates, deaths, impacts on nutrition, and the increase of mental health issues among Latinas. We all still remember seeing and feeling this feeling of disparity when New York became the nation's epicenter early on in this pandemic, followed by the mass devastation that resulted from it. And this is a year ago. 1 year later, COVID outbreaks are now concentrated in Arizona, California, Texas, and Florida, where a larger share of the US Latinx population lives. As of March, I pulled some data from the CDC, and Hispanic or Latino persons are still 1.3 times more likely to have cases of COVID-19. We're 3.1 times more likely to be hospitalized from COVID and 2.3 times more likely to die from COVID-19 in comparison to our white non-Hispanic counterparts. As it relates to Latinas, I will say that much of the research and the data has been focused on pregnant women. In a study conducted by the University of Pennsylvania from April 2020 to June 2020, pregnant Black and Hispanic women were found to be 5 times more likely to be exposed to COVID-19 than their white and Asian counterparts. In California, though, I'm a Los Angeles resident, and earlier this year, I remember really the horrifying feeling that we felt when our daily deaths by Latinos had increased 1,000% after the holidays. This meant that the rate went from 3.5 deaths per 100,000 to 40 deaths per 100,000. This was also at a time when vaccines were not yet readily available, and therefore this feeling of despair that I think we all felt was really an insurmountable one. Today, Los Angeles County still remains the nation's epicenter for this vaccine, and sadly, Latinos still remain overrepresented in COVID cases and deaths, while being still underrepresented in vaccine access. So much more needs to be done.
Thank you, Berenice. I'll now, and just because we have two wonderful Alejandras in the room, I'm going to address them by last name. But I'll now tip it to Ms. Castillo, if there's any comments that you would like to also add.
Yeah, well, first of all, I am so happy that we're doing this conversation, especially among CHCI alums, and I love CHCI. I thank CHCI for bringing me to Washington, D.C., and 30 years later for almost keeping me here as well. So I'm of the class of 1992. I used to keep it as a top secret date, but now it's like, I'm just so proud to be a CHCI fellow. Couple of things. I'm in a very unique position because I just left, literally. Today was my last day at YWCA. So I am a free agent, and now I can speak. I'm not beholden to anything, but I can speak very freely without attribution to my previous employer. But here's the thing. I'm a New Yorker, so I'm gonna rock the boat a bit. And I'm almost angry because, in fact, Berenice, you are absolutely right. And yet, we have this group of the population that's so surprised at how COVID has really hit Latino communities so disproportionately. This surprise of how is that possible when we, particularly the people on this Zoom call, we've seen it, we've grown up with it. I was born in Elmhurst Hospital. It was the epicenter of COVID. You saw on the evening news the makeshift morgues coming to Elmhurst Hospital. That is where I was born. I grew up in Corona, Queens, New York, which is where you saw so much of this COVID pandemic hitting us. And when you take the train, and we all know this because when you grow up in a city, you're defined by the train or the bus line. The train that defined my community was the 7 train. It is the lifeline of labor for Manhattan. Those are the folks who are working in restaurants and hotels, who are keeping the city of New York alive. And I'm sure that in Chicago, you have something very similar. So for me, it's been a moment of almost being so insulted that now we're looking at these social determinants of health. My neighborhood has the highest asthma rate prior to the pandemic, the highest asthma rate in the entire city of New York. So many different issues, as Bernice said, the structural healthcare discrimination in so many ways, in terms of education, in so many different things. So I would like to invite us, as we continue this conversation, to keep that very top of mind, because the way we will get through this pandemic and the way we will design the future of our country has to be with the mindfulness and the intentionality that we have to dismantle these issues. We have to dismantle these structural impediments to health, to education. We haven't even talked about education, but it was great for many families to say, we're gonna go online. Guess what? In my community of Corona, Queens, which is now predominantly Mexican-American from Puebla, it used to be Dominican, now we have Dominicans and Mexican-Americans really tight. Most of those parents didn't have an email. Let alone talk about helping their kids with homework. So again, I'm trying to invite folks to be very mindful, because President Biden just announced a $2 trillion infrastructure investment. And if we're not mindful of how we're going to really talk about the investment, the social investments on infrastructure, and how Latinas must also play a critical role, then we're gonna miss this opportunity to redefine and reimagine what the United States of America can be about. So allow me to be that voice that rocks the boat a bit, but I'm thankful for the invitation to be here tonight.
Thank you, Alejandra. Well, this is definitely the space to rock the boat. I'm all for it. I think everyone else in the audience as well, if they could snap, would be snapping right now as well. Ms. Aguirre, I also want to provide an opportunity for you to share. I know you have an extensive background in economic development and also in promoting more Latinas in positions of power. Would also be curious to hear your thoughts. Oh, I think we have her. There we go. Okay. Sorry, you muted just quickly.
Okay. So thank you so much for having me as well. I do want to echo what everybody else has said, say thank you. And definitely want to echo what my tocaya Alejandra is saying as well. I don't think that there's anything surprising about, all these numbers that are coming out, right? COVID just put a magnifying glass on the issues that have already existed in our communities, the issues that have been perpetuated. And in terms of small business ownership, I think, you know, again, it's just a magnifying glass. The lack of capital access, the fact that as Latinos, Latinas, we don't have, you know, this reserve of cash sitting in our bank to be able to turn around and save our business, or to keep it alive for a couple of more months, or to be able to access a bank loan or a federal loan, or even when the PPP came out. You know, Latinos were getting it at half the rate that our white counterparts were getting it. So that in of itself is showing that disparities that we face, as well as the caregiving roles that Latinas are usually assigned with, right? So now you have your kids staying at home because they can't attend school. So what does that look like? And that disparity that also comes with it, as well as the technology gap, which Alejandra also mentioned. I personally had to really, really quickly pivot my entire business into e-commerce. And even as someone who had, you know, my extensive background, that was a challenge. And so how do we ask our small businesses to all suddenly turn around and create an entire business plan, an e-commerce business plan, when many of them don't even have access to the technology needed to, you know, teach just their kids to do their homework. And so all these disparities keep being perpetuated. And now we see it with the COVID vaccine, that we still see a higher rate of white people being vaccinated than Latinos, Latinas, because of this technology gap. So again, these are just being magnified.
Mm-hmm. Thank you for everyone for sharing your insight there. And all important to this conversation, particularly as, you know, this nation has seen the exacerbated effects of health disparities, and it's going to be a continued issue moving forward. I am getting a little bit of background noise, but we'll go ahead and move on to the next question. Alejandra, Ms. Castillo, I would be curious to hear more. I know that you recently published a white paper with the University of Texas LBJ School. Could you take a moment to share some of the findings that you had written out in that white paper, and also what makes you hopeful that this pivotal moment has the potential to translate into meaningful change?
Yeah, so that's interesting. So in October, the New York Times coined this term, the she session. And as an econ person, as somebody who really thrives on looking at society through an economic lens, it piqued my interest, and I said, let's go deeper on this. And I think we're going to share the link to the white paper. So it's really about the she session, but it focuses on two areas. It focuses on childcare, and it focuses on the future of work. And I know that there was a comment about the professional gains that we have made and how do we hold on to it. So let me parse it out. The childcare is Latina women. I mean, school was our primary childcare. Abuelita was our primary childcare. Guess what? Under the pandemic, that disappeared. We couldn't leave our kids with abuelita because we would expose our grandparents to the pandemic, and schools were closed. So you saw not only did the service industry, which Latinas are highly represented in, and in total, that lost a lot of jobs. You know, Macy's retail just disappeared, and hotels disappeared, and restaurants. So we saw not only a loss of jobs, but then we also saw a loss of employment because we didn't have enough of a support for our childcare. Let me take the other angle, which is the future of work. If you are in the retail industry, in the service industry, how are we going to help all of those Latinas to pivot to the jobs of the future? In our country, we have a very failed system of workforce development. It falls through the cracks. It's not the Department of Labor. It's not the private sector. So who is responsible for it? And we need to start looking very futuristically as a Latino community, because automation, artificial intelligence, VR, everything is going to change completely the ability of getting and sustaining a job. And Cristina Antelo talked about pay equity and so many issues that still challenge women, Latinas in particular. So The white paper was in conjunction with my alma mater, the LBJ School, and Victoria Di Francesco Soto, who many of you may see on MSNBC. But we really wanted to dig down and really sound the alert yet again, because this alarm has been sounding for quite some time. But now it's like, how do we take it to the next level? Because my fear is, and you're seeing it, the data is telling us that the jobs that are coming back are not necessarily coming back for Latinas. The jobs that are coming back slower, and they're coming back for white males, and then it starts to trickle down, and Latinas are still at the bottom. So we have to pay attention to the numbers, and I just want to send this because I'm very passionate about it. Disaggregate the numbers. Don't absorb the numbers that the media is giving you without questioning. How do Latinos fare? And break it down by age, by as met geography, because the numbers that impact us, the true numbers, is a very different reality. So that was what prompted the white paper.
Thank you so much for sharing that. And I think that brings us to, especially as our society continues to evolve, and especially with the heavy influx of technology that we've been using. Berenice and I, we both work in the healthcare space, and it's been nonstop talk about telehealth lately, especially. So I think we don't have to focus necessarily on telehealth, but Berenice would like to ask you a follow-up question to that of, where do the greatest opportunities currently lie to reshape and modernize industries, and also within the healthcare industry, in a more equitable way?
Absolutely. Thank you, ALIZA. So I think that where I want to start is really around access to healthcare. A lot of the jobs that our communities do are service in the service field, which is great. However, a lot of those jobs also don't come with benefits. We've also seen in this pandemic the increase of jobs, like, for example, at Amazon or Uber and Lyft, kind of the gig economy. And those types of jobs also don't come with healthcare benefits and the worker protections that we really need to see in order to make sure that our Latinas are protected. For example, over the last year, there were a lot of Latinas that had to take unpaid time off due to school closures, or somebody in their family getting sick, or a COVID exposure. A lot of folks don't know that your employer, even with benefits, they may cover the first time that you are exposed, but not the second and the third time. And so this time runs out really quickly. And if you don't have the benefits to cover you and the protections, then that really puts you at a severe disadvantage. I also want to take a moment to talk about telehealth, because to me, telehealth is an equity issue. Right now, the conversation must be centered on equity. I said early on in our conversation here that this is a Latino pandemic, and a lot of the devastation that we have seen, the loss of life, because our families now, our community is forever changed for generations to come, because we've lost the matriarch of the family. There's been families that have lost, multiple family members, so in this kind of like 1 year later, I think we're all so blessed to be able to be here together in a virtual space, because we also know that the bulk of Latinas don't have the opportunity to work from home and be safe here at home. And so these are all the things that I think that the pandemic has revealed. But as it relates to telehealth has been has provided an opportunity for folks that rely on government-sponsored programs, primarily what folks know as Medicaid, to receive their care this way in a virtual format. The reality of the matter is that like us here, we have the ability to do this and talk to each other via video. A lot of our patients, they don't have that. There's a huge digital divide that I know we all are very aware of. But a lot of the times our patients are calling us over the phone and having the doctor's visit over the phone with their doctor, so there's a lot of work to do on the digital divide, but the conversation right now is, at least for community clinics, which I represent, federally qualified health centers across the country, is that these, for the first time ever, our folks that qualify for our services have access to telehealth. And we know that these services are going to go away when this public health emergency comes to an end. And that, to me, is a huge equity issue. We're again going to hit a community that has been devastated by loss of life and case rates and job loss. And we're now going to take away a benefit that those of us here, or those of us that have the privilege of having commercial insurance, have had access to telehealth for many years. It's not a new technology. And so we need to not take it away, because, our communities are complex, and there's a lot of chronic conditions that our communities deal with that have exacerbated the effects of COVID for many, and we have to protect it.
Thank you so much. No, those are all super important points, and especially having worked in that similar space and working at the National Association of Community Health Centers, I'm a community health center patient myself. My mom is. I've seen the impact they do. I'm from Idaho, and it's not just an issue that you find just in rural places. It's also an issue in urban places. Breaking that digital divide and bringing it together in more connections, while also bringing in promotoras and community health workers that just need reimbursements for that, so we can continue to bring them into the healthcare team. I now want to shift the conversation a little bit to workplaces. And Ms. Aguirre, would be curious to know, what traits do you have to call on or cultivate in order to defy convention and break barriers, not only within the workplace, but across industries as well?
So I mean, definitely to maintain, some level of success during COVID with my business, and even all the vendors that we were working with, it was that networking, that community aspect of it, right? That nobody else was going to really come and support you unless you reached out and said, hey, this is the situation we're in. And I need your support. I need your help. I need you to, share, like, comment, do whatever is possible. And I think that is what is so powerful for the Latino community, right? That we have that ability, that connection, that community to bring us together and to bring the successful parts of everything, of whatever it is that we're doing, as well as being resilient. It's in our nature. But I do think that those focus on things that, that I can do, that you can do, right? I think that there needs to be more focus on some policy changes that, for example, PPP loans should not just cover salaries, right? That for Latina employees, for business owners, that we tend to have less employees, that we tend to have more operational costs. And if we were able to have a loan that covered that versus just salaries, we would be able to have access to something that would really help us and grow and continue to either survive or grow the businesses that we're leading. So those types of outside sources would be helpful, as well as grants that tend to focus on businesses that have been established or have like this really, really big thresholds of income, when the reality is that we have businesses that are unconventional, right? Like, how often do we think about street vendors as small businesses? I think many times people think about small businesses as being your larger business that maybe is providing some kind of service as a freelancer, but our street vendors tend to be the foundation for a lot of our Latino communities. And so considering what services or what kind of policy changes can be implemented to support them, I think is actually something that we need to think about to continue their success and keep them alive, essentially.
Thank you for sharing that. And that'll be important, especially with this administration, and holding them accountable to the many commitments that they've made, and especially with the upcoming legislative package that's currently being shaped and created. I have another question for everyone here. Would be curious to know what advice you would give to other women, other Latinas that are driving and creating change within their fields, or as well aspiring to. And this can be whether in the workplace, in their community, at the federal level or state level. Well, let's begin first with Ms. Aguirre.
So what advice would you give to other women on driving change? I think because I work from a social venture perspective, everything that I do is driven by purpose, right? The people that I will be impacting, the lives that I will be impacting. So I think that's probably my strongest advice, that you are very intentional with the things that you are doing, whether it be for profit or nonprofit. That there is an intention behind the things that you are working towards, because I think that when the late nights come around and you have so much work, or you have really difficult problems to solve, that ends up being what pushes you, what helps you push through.
Thank you. I'll pass it on to Berenice.
So my advice is to do the work, right? Like, I think that now that for those of us that have the privilege to be at the table, that privilege comes with a lot of responsibility. And so even if you find yourself in a system where you feel like it's very rigid and they're not moving in the direction that you want them to move in, you just have to do it. You have to chip away wherever you can. I often find myself in situations where it seems hopeless, right? They're not moving in the direction that I want them to move in. They're not creating this opportunity that I want them to create. And I'm a good compromiser, and I'm a good convener at getting people to the table. And I can usually get some sort of compromise at that moment. For example, I will give you all an example. We're working really hard on the vaccine front right now and making sure that we're getting the vaccines out to our patients for community clinics. There's also a huge need in community. So I was able to work with our organization and our partners internally to create a specific allocation of those appointments to go directly to the communities that have been the hardest hit. And that didn't come, that came with persistence, and that came with partnership internally. But I really do strongly feel that, somebody has to ring the alarm, and when you have a seat at the table, you have to do the work to create the opportunities that will bring services to the communities that we all care about and come from.
Thank you so much. No, I mean, I completely identify with that as well. I used to work in the health insurance industry, and it was a big monster and fighting every day, but knowing that, we had small achievements or even big ones in the Medicaid space that were great and kind of keep our passions going. Ms. Castillo would also be curious to hear your thoughts.
Day I was walking, and I really came across the feeling of survivor's guilt. And let me tell you what I mean by that. I asked myself, I was born in Corona, I grew up in a Latino community in New York City. Why am I being spared from all of this, of everything that's happening? I am one of the privileged ones. And I had to take a moment of introspection. And I think we all need to do that, which is, what is it that we are being used for? How will we use our voice at this particular moment in time? And maybe what I've done in the last 30 years of my life is not what I'm going to be asked to do in the next 20 years. And that is the moment where we also have to start thinking about, let's leverage this moment to learn. Just because you finish college doesn't mean your learning ends. Let's learn something different. Let's look at life from different lenses so that we are much more informed when we're called to lead. And I think that this moment in time is really asking us, one, to make sure that we know what's the battle we need to tackle. Two, to make sure that we create a community of like-minded people who are willing to fight the good fight. And three, how are we going to be the best expression of ourselves? Because there's a reason why in this group in particular, we were selected to be leaders in our community. So I don't want to let this moment go by without that introspection and asking ourselves very, very, very quietly, but very deeply. How are we going to metamorphosize? You know, I see Berenice has a poster of butterflies. I love butterflies. How are we going to change so that we can be the drivers of change? Because doing the same thing we did last year or the year before may not be the way to go forward.
Thank you all. Those are all important. And another, I think, you know, continuing to surround ourselves with those that are like-minded in our support system is so important. I know that particularly during this pandemic, I've had many losses, and I'm thankful, so thankful for my family and friends, and being out here in DC away from my family, and even my colleagues at work, to be able to support us, and also just making a pitch for our mental health as well. Taking time to, you know, seek therapy if you need that help and that assistance, or to lean on others. And also, while we're always fighting every day, because these issues are so much closer, or very close and dear to us, and impact us every day. But also taking a moment to step back and just recharge ourselves so that we can continue to fight every day. I want to take this moment to offer a reminder to the audience that if you have any questions, to please submit them in the comments. We do have one question that I wanted to go ahead and bring up from Gabriela Sosa. She asked, as emerging professionals, how do we position ourselves to a workplace post-pandemic? And would like to open it up to our speakers, whoever would like to answer that question.
I can jump in if that's okay. I'm thinking about that, right? We haven't yet brought our teams back into the office. And I think that what we have learned over the last year is also to just kind of like be flexible and go with the flow. And so as we think about how we can create a hybrid model, we also have to learn to be flexible, because we're not out of the woods quite yet. Schools are not fully open yet. We are going to have staff members that have to still take care of their children, or, you know, just be flexible. And so to me, that has been, I think, what has gotten me through the last year, just to be flexible, but also really to be very mindful. And like Alejandra was saying, like have that moment of introspection to say, like, what are the priorities going to be moving forward, and how can I support them? And for me, it's always going to be health equity, health equity, health equity. And so that's what I'm going to continue to keep as top of mind in every priority that I carry forward for the remainder of the year and going forward.
I'll jump in and say, first of all, I want to echo the mental health. I think it's the silent pandemic that is, I think Dr. Fauci actually said that in so many words, but we are witnessing, and in our communities, as we know, mental health, having a conversation about mental health is a huge taboo. We have to dismantle that. Those are our own cultural, pillars that we have to dismantle. So very much taking care of your mental health, and also finding your joy, right? What is it that you're interested in? What are you passionate about? Where do you think that your energy is going to be revved up to the point where you're going to just do it because it is where your joy and your passion is? I know it sounds cliche, and we don't, as women, sometimes allow ourselves to think in those terms, but we have to really figure out, like, in the next 20 years, what are those issues that we're just so passionate about? I love health equity is Berenice's passion. What are the passions that are going to say, this is where I want to lead? Because what the pandemic has shown us is life is very fragile and very precious. So you might as well use this moment and really, again, figure out, how do you position yourself? How do you educate yourself? How do you get yourself informed? How do you position yourself in that space so that after this pandemic, you can thrive from a professional perspective? I'll tell you, I'm very passionate about cybersecurity and cyber warfare, and I'm reading everything I can, not because I want to be an expert on it, but because I know that that's going to be a huge issue moving forward. And if, with all my experience, if I can get that lens as well, it'll position me. So I invite folks to think about given your profession, what is that added lens that at this moment in time you can drill down on and really reposition yourself once we get out of this pandemic?
Yeah, I think if I can add something to that, it's finding balance. I don't know about y'all, but I'm finding myself working more than ever. And I think that in the midst of that, I'm losing parts of who I am essentially, right? The creative aspect of the work that I do, because we all need that to solve the issues that we're trying to solve, right? It's not just like creative in terms of like colors and, you know, drawings and all of that, but like, how do we solve the issues that we're trying to solve? And so finding that balance and knowing that even now when we're not out of that, we're not cleared, that we have to find that time to cut that work and go outside and get some fresh air and work on your mental health and do all of that. So I think balance will be key to a post-pandemic world, to kind of go to a new normal, right? Because people are like, oh, when are we going back to normal? I think that's gone. It's left in the past. It's going to be a new normal, and it's up to us to redefine what that will look like, which I hope it includes balance and that it includes a space for us to be flexible, like Berenice said.
Mm-hmm. Thank you all. Wonderful responses. We're getting such amazing questions in the chat, and I love our questions as well, but I think I want to shift it a little bit to the audience. So we have a question from Yvette Maldonado. Her question is to each of the panelists. With what you know of the workforce development effects of the pandemic, what career advice would you give a Latina who is in college right now or a high schooler thinking of going to college? What education route should they take? And I'll open it up to whoever would like to answer that one.
This is also an issue with Latinas. We are very polite. We are very polite, and so again, I always
go for it.
Right? I always challenge myself, like, speak up, better. You know the answer, right? So I will just say that I want to, I just figure out what is the thing that you want to focus on, what is the passion area, but don't think too far into it, right? Like, don't try to have it all figured out. I tell people, it looks like I had a path, very specific path the whole time, and A led to B, led to C, led to D. That has not been my experience at all. I had an idea that I would be, working in a clinic, being an ultrasound technician out of all things, right? And look at me now. And so I think if I would have done that, I would have limited myself and my capabilities, because it really is the experience that I'm in that really leads me to the next thing. And so don't try to figure it out. I know it looks like we have it all figured out here, but even Alejandra right now, right? You're in this transition period, trying to figure out what's next. And I think that that's the secret sauce right there, right? That you are always in a space where you're working in your passion area and that you're growing. And then that growth will lead you to the next opportunity and the next opportunity. And so just, that's a little advice from, someone who may or may not have more ganas after a year here.
No, I agree with you. And I was kind of quiet when it was asked, because I was thinking about it. And I started my career, in DC and doing office work and, wearing the suit and all of that. And now I'm on TikTok making videos and making money that way, right? And supporting my community that way and letting people know about small businesses, which is so unconventional and not linear at all, and not the way that my Latina brain, first generation immigrant brain thought things would go, right? Because I felt like I owed so much to the people that had come before me, especially my parents. And so to think that I would take this unconventional path to see a ver si las cosas trabajan seems so wrong. And now it's a space that brings me so much more joy, and I get to share it with my community, and I get to create a space that is very different. So definitely want to echo what Berenice is saying, and not thinking so much about well, is this going to lead to this? Is that and that and that?
Yeah, and I would say the same thing. You know, I've reinvented myself at least 5 times, and every time has been exciting. And as my tocaya said, a ver lo que pasa. But but I will say that as you finish your high school, as you go into college, really drill down on some very important building blocks, and that is critical thinking. You know, take a class that will challenge you, whether it's a philosophy class or a math class. Take a STEM class, absolutely. Something in the sciences, in the math, in the area. And then really drill down on communication and your writing skills. Those are 4 building blocks that no matter where you land, you will always use. And at the same time, do the work, do it well, and then, you know, life will unfold. It's scary at first, but life will unfold. And always make sure to keep healthy relationships, because you never know who's going to be that individual who's going to advocate for you, who's going to validate you, who's going to open doors. And people, mentors and sponsors come in all sizes and shapes. So just have some really strong building blocks and always ask for help. As Latinos, we don't ask for help. And I always learned, I read this quote that I love: if you want a friend for life, ask for a favor, right? And that's because people become invested in your future. They want to see you succeed. So don't be ashamed to ask for help and raise your hand or ask the question that everybody wants to ask, but they're just timid to do it. And trust you're doing the right thing.
Oh, thank you so much, every one of you. I couldn't agree more with Liz. She wrote in the comments, pearls of wisdom for all of us, and that is exactly what I think as well. We have another question from David Jaramillo, who asks, as an adult educator, what should I know or look for when working with my Latina students, many of them who are mothers?
Yeah. I'm going to jump in because I just led one of the largest women's organizations in the country, and as a Latina, as our community doesn't necessarily understand that we need to be more trauma informed, and what I mean by that is it's a whole area of study, but the different traumas that we live through in our lives, whether it's poverty, the fact that every month you hear the same conversation about the bills and paying the bills and when the bills are coming, whether it's loss, as we just experienced, whether it's abandonment or love, and when you have young moms, the relationships are very challenged. But it's important to have that trauma-informed lens, because it's also very important as we learn, and the triggers that help us learn, not just the ones that prevent us from learning, but the ones that also can help us learn. So I would invite you, to just think about how can you get more information on the trauma-informed, using a trauma-informed lens as you approach education, especially for adult, young adult women.
Thank you, Alejandra. Are there, just out of my curiosity as well, are there any specific resources or organizations that might have those tools or resources to reference to?
Sure, there's a lot, again, the quintessential Google, but there are a lot of organizations. I know YWCA has a lot of trauma-informed work that we do, but also, there's resources in the healthcare space in terms of social determinants of health. So there, I don't have anything ready, but I'll Google in a few minutes and maybe put it on the chat.
On social determinants, I will say the Kaiser Family Foundation is a great place to start, just in terms of the healthcare lens. There's a lot of really good explainer videos on there. And then what I would like to add to Alejandra, just as a former student, Latina student myself, is sometimes all it takes is to be invited to the conversation. We don't, it's sometimes not as natural to insert ourselves. And I often find myself, telling people pull up a chair, come to, sit at the table, come pull up a chair, and inviting them because folks, it's not, I think, instinctual or something that everyone does. So just remember to invite your Latina students to the table.
And I'll just I mean, they said everything. But if there's, if you're already scrolling through your Instagram, through your Facebook, there's a couple of pages you can be following that give you some little gold nuggets, brown girl therapy, Latinx therapy, therapy for Latinx, all of those resources. There's small reminders throughout the day of things that trigger a reminder for you to be able to work with your Latina students and to better understand women of color in general in our trauma.
Thank you. We have another question from Leonardo Julian Rodriguez, who asks, how can we work, and this is specific to the vaccine as well, how can we work within the Latino culture to get relief into these homes and trusting the vaccine? Do we target the matriarch of the family, more Spanish services? Probably pitch it off to Berenice for this one. That's their insight.
Yes, I would say yes to all of the above, right? I think for our familias, it's definitely the mother, but we're starting to see a lot of equity initiatives roll out across the country, which if you ask me, it's I think a long time coming. For those of us that, come from these communities, we knew kind of that by design, they're set up to have these social determinants of health that we keep talking about. And so here in the state of California, we pushed and pushed and pushed, and the numbers really told the story that there had to be some targeted equity pushes as it relates to the vaccine rollout. So 40% of the vaccines are being designated to the hardest hit communities here in California. We know that this is also kind of a tenet of the Biden administration's plan. It's rooted in equity. And so a lot of the states are, responding to the call and saying, we are also going to prioritize equity within our vaccine distribution and implementation. I also want to take this moment to shift the conversation. As of right now, we keep hearing the term vaccine hesitancy. I want to challenge you all to not say that and instead say create additional access to vaccines, because what we're seeing right now, and it's not necessarily a hesitancy, it's just not knowing how to navigate the systems to get an appointment. It's not in the right language, not knowing if you're in an eligible tier depending on your state, and just really not knowing how, for example, a vaccine is going to interact with your diabetes medication that you're taking, right? So sometimes it's questions that are that simple, and where we have the advantage in the healthcare community for Latinos, their healthcare provider is one of the most trusted messengers. And so we're really, using that position right now to educate and to get folks to get the vaccine. And then finally, I will also say here in the state of California, we are now, as vaccine providers, able to have the flexibility to vaccinate as we see fit, now that there are actual vaccines out and available. So now, for example, if someone comes into the clinic and has their family with them, we can vaccinate the whole family together. And so we really hope that we will continue to see this across the country, because it doesn't make sense for us to vaccinate the mom and send her back to the home, and there's a very complex living situation going on, multi-generational or whatever the case may be. And so yes to all of the above: messaging, education, outreach, and then mobilization. We really need to take the vaccine into the communities and meet folks.
Yeah. And Berenice, I want to echo that, because I'm in Florida, and the reason I'm in Florida, I moved to Florida because I have an 81-year-old mother. And in Florida, you have to have a car to go to a park to get vaccinated. Now, my mother, I don't want her to drive at 81 right now, because so if I weren't here, I think I would have lost my mom for many reasons, right? Mental health issues, not knowing. So there's a role for us as individuals as well, as daughters, as aunties, as everything, to be that amplifier. As well as somebody commented, policy is the driving force. How do we make sure that our decision makers, our elected officials, are recognizing that not everybody can drive in the middle of the day to a park to get vaccinated. And not everybody can, take the phone call that comes in English first to get vaccinated. So there is a lot that as individuals, I think we will need to step in, because the structure is not being flexible enough. So I also say that if you know of somebody that you haven't been in touch with in a while, call them up, check up on them, say, have you been vaccinated? And be that conduit wherever possible.
Thank you. We have just 3 minutes left, and before I just want to end on a positive note. So I'm going to start this question off to Alejandra Aguirre, but would just be curious to know what continues to inspire you throughout this time. What continues to just give you power, that fuel, just to keep going, to re-energize you? What brings you joy? No, that's a lot, maybe. So, and there could be multiple things as well, but I'll pass it up to you, Alejandra.
Yeah, well, because I work with artisans, I think that just seeing their resiliency and continuing to make and create, and to see that people are still supporting them, still supporting us as small business, that truly drives me, and that inspires me to continue doing the work that I do. Because if we are able to keep this momentum during the pandemic, it's kind of like, it's only up from here, right? Or at least that's my attitude. So that definitely has been a driver in the work that I do.
Ms. Castillo, I'll pass it off to you.
I'm excited. I'm excited because for the first time in a very long time, I feel that as a community, we're holding tight together. I also feel that as a nation, these issues that we knew about have now come to light, so there's no, deniability of it. And I'm also positive about how this new administration is going about things. But here's what we all need to do in this level of hope, which I'm very firmly committed to. We have to keep people accountable. We have to push the envelope. And we need to make sure that we don't go back to the old ways, but that we can reimagine a future that is truly inclusive, and asking the tough questions, right? So I know I'm going to be doing my share of that. So I'm excited because there is an opportunity to be the architects of our future. And as the census is going to shortly tell us, Latinos are going to break the 20% mark. So we are definitely the future of this country.
Oh, that's getting me excited. Berenice, I'll have you wrap it up.
I know, me too. I'm getting motivated by my fellow Latinas here, Power Latinas. So what keeps me personally going is my familia, very honestly. If you ever see a picture with me and my nieces and nephews, you'll really see me light up, bigger than this smile that you see here. So that is on a personal note. And on a professional note, it really is the gains and wins that we have gotten as a result of this pandemic. We're getting services out to the community. We're getting vaccines. We're getting higher allocations of vaccines into certain communities. And it's the stories that I hear of folks just being so excited and happy to get their vaccine and feeling like, we're going to regain some sense of normalcy, whatever that new normal looks like. So I'll continue to fight every single day to make sure that we get closer and closer to health equity and that folks have what they need.
Thank you so much. Oh, I am so excited again to have been here to join each of you tonight. Thank you to each of our amazing panelists and speakers, to Alejandra Aguirre, Alejandra Castillo, Berenice Nunez Constant, Cristina Antelo, and to our CHCI team who helped put this event together and helped with managing the tech. Thank you all for joining us tonight. We hope you'll join us for many more CHCI events. And thank you, everyone. Exciting.
Thank you.
Great job.